So if you've been diagnosed with tinnitus or ringing in your ear, or maybe you would describe it as fullness or stuffiness, or I've actually had people tell me they feel like there's cellophane sort of sound inside their ear. Usually at Freedom Physical Therapy, after you've been assessed by one of our temporomandibular therapists, we certainly would like to make sure you've been screened by an ear, nose, and throat doc. So that's always helpful for us, just to make sure, right, for example, you don't have any wax in your ear, that possibly your hearing is fine. So sometimes they'll refer you to an audiologist to make sure your hearing is intact. But basically, we just want to know that at least as far as the ENT is concerned, the health of your ear is fine. Then we kind of have to dial in another potential cause. Could be temporomandibular joint pain, temporomandibular disorders. Not uncommon with some of my pretty severely degenerative and arthritic temporomandibular joint patients. If they're also dealing with some inflammation, I find that combination can contribute to ear ringing, ear-related symptoms. So oftentimes, as we improve the mobility of their jaw, we significantly reduce their pain, we help manage the inflammation, and possibly we get them back to their referring or primary dentist or a TMD specialist, and they wear a nighttime appliance. All of those factors can really contribute to helping reduce the severity or intensity of the ringing in the ear, fullness, stuffiness in the ear. Other things that we would look at if the joint is even healthy are the muscles. So we kind of know from what we call trigger points or referral patterns in various muscles. Some muscles, the muscles of mastication and even from the neck, can contribute to ear-related symptoms. The few that we tend to go after is the lateral pterygoid, which most of us truly believe you cannot palpate the lateral pterygoid. So that is one thing where, because all of our therapists at Freedom Physical Therapy are certified in dry needling, that's the beauty of dry needling. It allows us to get deep into that lateral pterygoid muscle and access it where our fingers cannot get. And oftentimes that can significantly reduce ear-related symptoms. Another muscle that we tend to target on the inside of the jaw is called the medial pterygoid. So that's another muscle. That one you can actually palpate with your fingers, usually intraorally. So we will do an intraoral type of palpation to get at that muscle, and affecting that and working on that can also contribute. Then a couple neck muscles that we would look at would be your sternocleidomastoids, a very important, prominent neck muscle, has been shown to contribute to ear-related symptoms. And another one that people often forget is very deep anterior, called the longus colli. So those are some subtle manual techniques that we can do to work on those particular things. Then we have some more advanced techniques, meaning that around the acoustic meatus or the ear area, there's some very skilled manual osteopathic techniques that we can do to mobilize very subtly, just millimeters, the joints and the cranial sutures in this area that can have a profound effect. And then for some of my more extreme cases that aren't responding to some of what I call the low-hanging fruit or the more basic approaches, can be an old osteopathic technique where we will go in, and again, it's not for everyone because the gagging factor can be quite high, but we can actually go in and very gently massage the palatine tonsil. And sometimes by reducing inflammation and really just massaging, effleuraging that palatine tonsil can free up and change the pressure inside the ear. There's also another technique intraorally and externally where we can do it. Almost would look like as if you're doing some lymphatic work, but very gentle lymphatic work intraorally and externally can be, again, just enough to change the pressure inside the ear, release the pressure in the ear. If there is some subtle inflammation that just can't be seen, all of those things can help to potentially alleviate tinnitus in the ear, so ringing, fullness, stuffiness, or again, as I mentioned, that cellophane sound that you might be dealing with. It's certainly a nuisance, but know within the skilled hands of an excellent physical therapist that's trained in temporomandibular disorders, they should have the tools to be able to help you address this problem.